Oh, hello there. Take a seat, make yourself comfortable. How are you today? Okay, good. A little bit nervous? Okay, understandable. Nothing to worry about. So let's just check what we're doing for you today. Right. Oh yes, it's the wisdom tooth, isn't it? Time for that pesky thing to come out, isn't it? It's been bothering you for quite a while. Yeah. Well, looking at your x-rays, I've seen that there's no real impact on the tooth next to the wisdom tooth, so it's just going to be the wisdom tooth that I'll be removing for you today. Okay. Because we were worried about the tooth next to it, weren't we? But that's going to be fine. Okay. There won't be any damage to that. All right. Okay. Well, before I start, let me just pop some gloves on. Okay. I'm just going to do a general little check round first before I do any teeth removal. Okay. So just get your head nice and still for me. I'm just going to feel around the lymph nodes. Okay. Nothing hurting there? No? Okay. Wonderful. Okay, could you open your mouth for me? Okay, could you put the tongue to the roof of your mouth? To the bottom, to the left, to the right. Okay, that's perfect. I'm just going to place my fingers on the temporomandibular joint on the side of your head there. And can you just open and close your jaw for me? And again, and wiggle your jaw from side to side. Okay, you couldn't feel anything cracking, popping. Okay, everything felt fine to me, no pain. Okay, just going to press around a little bit that area, nothing sore. Okay, that's fine, that's perfect. Okay, so if you'd like to just nice and still, I'll just pop this on. Make sure we've got you nicely covered up. There we go. All good. Didn't want to get anything down your nice clothes. Alright. So I just need you to open nice and wide for me. Okay, and I'm just going to take a little check around, especially around the area that we're going to be working on today. Alright, if anything's uncomfortable, please pop up your hand. Okay. Alright, so nice and wide for me, please. Thank you. I'll be coming in a little bit close. Okay, perfect. Okay. Alright. Just looking around at the bottom. Okay. Okay. Alright. I'm just going to take a look at the top. Nice and wide, thank you. Okay, so the wisdom tooth is your bottom left. It's the one that's caused you all the problems, yeah? Okay. Time to remove that one. Okay, I'm just checking the tooth next to it again one more time. Just keep nice and still for me. Sorry it might be a little bit uncomfortable, but I do need you to keep still, thank you. Okay. I think that's looking good to go. Wonderful. Just check the other side there. Yeah, that one's erupted fine. This one's been really problematic, hasn't it? And got infected many times. Okay. So what I'll need to do for this is to give you some local anaesthesia. Okay, I'll be giving you a few little injections around the gum area, alright, because I don't want you to be feeling any of this. There will be some very firm pressure to remove this tooth, alright, so don't be alarmed if you hear a few little sounds, or you will feel the pressure off me pulling, but you shouldn't feel any pain, and if you do, you need to tell me to stop and we can give you some more local anaesthesia, okay? Yeah, okay, you've got no reactions to local anaesthesia, have you? No, I can see the notes down here that are okay, that's alright. Okay, so let me just double check there. Okay, everything looking good. Right. So I need you to just open wide for me, okay? And I'm just going to be injecting this slowly around the gum area, okay? Right. Just relax, it's fine. Just take some nice deep breaths. You'll just feel a sharp scratch at first, and then it should start to feel numb, a little bit tingly, alright? Okay, so nice and wide for me. Thank you. There we go. Okay, just a little bit there. Okay, a little bit there. Okay, a little bit there. Just a little bit wider if you can, thank you. Use a bit of your bib there. Right, okay, let me just leave that for a couple of minutes. Okay, is it starting to feel a little bit strange? Okay. You don't have a very, very wide mouth, so it is going to be a little bit uncomfortable. Okay. Yeah, because I need you to open really wide for me to do this, and obviously getting the tools in. Some people have much larger mouths, but yours is quite small, so it might be a little bit achy on the jaw while I do this, okay? But I'll try and do my very best to make it as comfortable as possible for you. Okay, so let's just see how you're doing. Nice and wide for me. Let me just check. Can you feel this? Can you feel that? You could feel that a little bit, okay? What about round here? A little bit, okay. A little bit more anaesthesia for you then, okay? Nice and wide again, thank you. There we go. A little bit in there, and a little bit in there. Just relax now for a minute, okay? Give you a little massage on the jaw area. You should start to feel nice and numb now. Okay. Look a bit wide there. Okay. Let's just give you a check again. How's that feeling now? Okay, nice and numb. Perfect. Is that numb there? Okay. Alright. Nothing at all, you can't feel anything. That's wonderful. Want no pain? Remember, just tell me, pop up your hand at any time if you do feel some discomfort. Okay. Right, well, I'm almost ready to remove that little wisdom tooth of yours. Okay. So give me a couple of minutes and we'll get going. Okay then. One last little check. Nice and wide for me, thank you. Still numb? Yep. Good, good, good. Good, good, good. Just round the back there, is that numb too? Yeah? Perfect. Okay. So, what I need you to do now is to be really relaxed, okay? Breathe through your nose, okay? So take some nice breaths now. So in and out, and in and out, and in and out. Perfect, okay? I need you to open nice and wide now. Okay, as I'm going to go in and start to extract that tooth. Okay, as wide as you can now for me. Okay, coming in. Alright, there we go. Okay. Is that hurting you? Okay. Just got to give this a twist. I'm really sorry. I'm sorry it's feeling a lot of pressure there. Okay, keep twisting it. They do take some removal, I'm afraid, these teeth. Okay. Oh, that's a tough one. Alright. Okay, there we go. Okay. Oh, that's got it. You want to see it? Yeah, sure. What's in there? Can you see? I got it. Right. I need you to bite on this. Okay. Really, really hard. Okay. Bite down on that. Okay. That's perfect. Just going to give you a little bit of suction. Okay. Keep biting, keep biting, keep biting. Okay. Just the suction coming in now. That's wonderful. Keep biting down for me. Okay. Clench really hard. Okay. Now just open a little bit. Let me just take a look. Okay. Bite down some more for me. Would you like to keep your tooth? Yeah, sure. I'll do that for you. Alright, just open wide for me a second. Thank you. Let's take a little look. Okay. I'm going to remove that part. Okay, and here's another for you. Bite down nice and hard on this, please. Super. Perfect. Stay in that position for a little while. Okay. Wonderful. Okay, just open a little bit for some more suction. Okay. Okay. Let's take another little look. Alright then. Wide for me, thank you. How's that feeling? Okay. Sorry, there was a bit of pulling, tugging. They are quite difficult to remove. Okay, just pop that packing piece back in. Okay, so while you're biting down on that, just want to give you some aftercare. Okay, take paracetamol for the next day or so because you will feel a little bit of soreness. Okay, the idea is not to get a dry socket. Okay, so there'll be a blood clot that should form on that. Okay, we want to try and keep that there if we can. Dry sockets can become painful, infected, and very, very uncomfortable and can make you feel very unwell. Okay, so what I need you to do is not have anything to eat or drink for the immediate time, next hour or so. Try not to eat on that area for the next few days if you can. So try and eat on this side. You can start having drinks in the next couple of hours, okay? Not too hot, if you can help it. Try and avoid anything sticky, sweet, acidic and crunchy, okay? We really don't want to have anything that's going to remove the clot that will form over that. Okay? Yeah. And then also, as of tonight, I'd like you to start salt rinsing. Okay, so just get a cup of water, warm water, and half a teaspoon of salt. Mix it round, put it into your mouth, hold it in your mouth over the area till the liquid starts to cool a little bit. Okay, and then spit it out. If you can repeat that probably about 4 times a day for the next week, that will help heal and prevent infection. Okay? Alright, so let's just check that again. Okay, and bite again. So hopefully there won't be any issues. Do expect some discomfort though for a little while. Now what will happen, there will be throughout the day, there will be some oozing from that, a little bit of blood which you're happy to spit out or even swallow. Okay, if it starts to bleed quite profusely, then you can get one of the pads we're going to give you that you're biting on now, just bite down on it for about 20 minutes. Okay, that should stop the bleeding. Okay, that shouldn't happen. Other things to avoid are like strenuous exercise, too much lifting, bending. You know, just try and keep quite calm for the next couple of days at least. Yeah. Okay, but you should be okay. Signs of infection, obviously, if you're getting swelling, a lot of pain, you're starting to feel unwell, as in you have a fever, you feel a little bit fluey, you know, all the signs that you've got something going on there in the body that shouldn't be. Okay, if that happens, just call us, come back down and we'll look at it, and it may need antibiotics. There are no guarantees that dry sockets won't happen, but we do everything we can to try and get you to prevent it. Alright, okay, so open wide. Let's just remove that one. Alright, that's perfect. Just keep open for me a second. Okay. Looking good. looking good. Okay, so just want a very, very gentle rinse, okay, not swishing around the area too much, just to remove some of this here. Okay, so take a little bit of that, thank you, and just into there. Wonderful. Okay, and I'll just give you a nice little bit of suction. Okay. Right, so we'll make sure we've given you some of the gauze pads to bite down on if you need to. So I'm going to leave you with this. Okay, so I'm going to pop that in there. There we go. Okay, now you need to keep biting down on this for a bit. You've got to lift home, haven't you? Good. Just keep it in as long as you can. Keep biting for at least half an hour. I know it's not the best, but it will really help calm the bleeding down and make it feel more comfortable. Okay, so you feeling all right? Okay, well, let's just remove your covering there. Okay, so be in touch if things don't feel right. Okay, and we can give you a checkup in about a week or so's time. The receptionist will sort that out. Is that okay? Good. Okay, enjoy the rest of your day. Take care and keep biting for a while. All right.